Hello, everyone. This is my clinical case study. I hope everyone's doing well, and I just want to say I'm excited to hear your case studies. But here we go. So my patient was a 32-year-old female. She was seen in October of 2021. She noticed a sudden hearing loss in January 2021. I do want to say she does have a medical diagnosis. It was not a sudden hearing loss, but she reported it as a sudden hearing loss in her right ear. She's reporting she's having trouble hearing at work. She works as a front desk receptionist at an optometry office, and she's reporting she's having more trouble hearing, especially when there's background noise and patients talking and the phone's ringing. She's stating that she's having trouble hearing the patient when the patient's right in front of her. So she does think that her hearing has decreased since the January 2021 sudden hearing loss as time has gone on. And I also want to note that she reports having no children, which I do think is something that is important to know. So, in her case history, she is reporting constant tinnitus in her right ear, and it has recently become more bothersome. From what the patient was saying is the tinnitus is, I think, becoming more bothersome than the hearing loss itself. She's doing she's doing okay with the hearing loss, but the tinnitus is really what's bothering her. She denies having tinnitus in her left ear. She also reports oral fullness in the right ear and denies it in her left ear. She denied any pain or drainage in her ears, a family history of hearing loss, and any excessive noise exposure, as in recreational and occupational. And she also denies having any dizziness or imbalance issues. And when it came to medical stuff, she denied any head injuries, stroke, diabetes, high blood pressure, heart conditions, and autoimmune disorders. So pretty much she overall is pretty healthy. The only issue she was having is that issue in her right ear. So when we look at the audiometric testing, I do want to note that otoscopy was clear bilaterally. Everything looked great. Her eardrums were intact and they looked good. In her left ear, you can see that everything is within our normal limits. We take 25 and above. And in her right ear, she has some hearing loss. It's about a mild to moderate at 2,000 hertz. Going back up to within our normal limits. So I think it's very interesting to see that there is a peak at 2,000 hertz. And it's just a very interesting hearing loss. She has type A temps for both ears. Everything again looked good there. Her SRT was 35 in the right ear and 10 in the left, which matches the PTA very well. So she was very reliable and she was very consistent when testing her. She got 96% bilaterally for word rec, meaning everything looked good with the nerve, and she was able to respond very well to that. I do want to note that we unfortunately do not have the ability to do reflexes in this clinic. Along with that, we don't have the OAEs. I think it would have been very nice to have that, especially with the asymmetry and that 2,000 hertz notch. I think it would have been nice to have the extra testing just to kind of get a better understanding and, have that as a good baseline for our clinic since this is the first time seeing her. So I guess this is up to you. That was everything I had to say about her testing. What recommendations would you give if you had to send her to a provider or any medical specialist? Who would you be sending her to? And like I said, the patient did receive a medical diagnosis. It's a very interesting diagnosis, and I'm really curious to see what you all have to say. And I'm excited to hear your case studies. So I'll get back to you soon. Thanks for listening.